This is a paid advertisement.
Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. We're visiting today with Dr. Matt Thompson of Tower Clock Eye Center. It's great to see you again, Doctor.
Thanks for having me here.
I'm glad I can see you. I'm glad there are no floaters in the way, so to speak. We're going to talk about floaters, and I feel like I should know what that is, but can you tell me what it is? Because I don't think I do understand what that is.
So inside the eye, there's a clear gel, and the light gets focused through that gel. A floater is basically a little speck of protein in that gel that shows up in a person's vision. It can be light or dark, different shapes and sizes, but it's very, very common for people to have floaters.
So I shouldn't feel overly alarmed if I do experience that sensation?
They're almost never dangerous. They're often annoying, but almost never dangerous. Sometimes when a person has a brand new floater that shows up, we recommend that they have an eye exam to make sure there's nothing dangerous going on. But for most people, it's a natural thing that occurs in life.
What is that occurrence like? You said it's different shapes and sizes. Is it a different sensation as well, depending on what you're dealing with?
Usually there's no feeling with a floater. It's just seeing this speck float around in your vision. And for a lot of people, it's a very minor thing that they notice sometimes, but it doesn't really bother them. But there are some people that it really is in the way and really gives them a lot of trouble, and they give it time to get better. Most people, it gets better with time, but some people, it just doesn't get better even though they wait a long time.
So when it does become that nuisance and you've given time the option to take care of it, what actually can be done for the patient?
So for people that have a floater that's hanging out in the middle of their vision and they've given it enough time to go away and it hasn't gone away on its own, there's often a laser treatment that we can do to break that floater up and get it to be less symptomatic. Most people with floaters, as long as it's a significant floater, are a good candidate for that treatment. And it's a very safe treatment. It doesn't work for every floater every time, but about 75% of people will say their symptoms greatly improve after the laser treatment.
Oh, that's a great track record for the treatment. How long does the actual treatment take for the patient?
The treatment takes about 5 minutes. Before the treatment, we need about a half an hour to dilate the eyes so we can have a good look inside the eye and see what we're doing. But the treatment's very quick, and then afterwards, there's no pain or recovery. You can go about your day like normal after the treatment.
Oh, that's great. It can truly change somebody's life if they've experienced this for a long time and have struggled with it.
Absolutely.
What's the best way for folks to get a hold of you if they have some questions or are just having trouble with their vision?
People can visit our website. There's information there, or they can call us to make an appointment at 499-3102.
Excellent. Thanks for being here today, Doctor. We appreciate it. If you need that information again, it's available to you right there on the screen and always at WBAY.com. We'll get you back to the Noon Show right after this.
The preceding was a paid advertisement.